After 1 month, about 10,000 to 20,000 people usually watch the episodes on LinkedIn. So live streaming is really a good point.
Mm-hmm.
Jordi, how do I spell your name correctly? You said you live in Barcelona. Is it Jordi is the English version, and how is it in Catalan?
It's Jordi Ferrer. Yes.
Also Jordi, also
Yes.
Jordi. Okay,
Yes.
I thought it would be Jordi or something like this.
So that would be in Spanish, but in the Northeast we speak Catalan, and my name doesn't. So we don't have the
Oh,
pronunciation. It's
really?
more similar to the French somehow. Yeah,
Is this such a huge difference, Catalan and I think it's Castellano, isn't it?
yeah,
The
Catalan Castellano. Yeah, it is a different language. Yeah, it is a different language. Yeah, yeah, yeah.
so it's Jordi, like the English pronunciation.
Exactly, exactly.
It's a great name. It always reminds me. I hope it's not impolite to say that. It always reminds me of Star Trek. There was this. If I think it was a technician in Star Trek: The Next Generation. It was Geordi LaForge.
Wow. No, I have never heard of that. I know there's a French song for kids, which the main character name is Jordi, which is kind of funny. But no. It's I never heard of this other Jordi, the one
Actually,
from.
I'm a huge Star Trek fan, so I
Uh,
think for Star Trek fans, this is something to look at. And you're currently in one of the greatest cities in the world, Barcelona.
yes. I am, yes, living in Barcelona. I was lucky. I mean, I was born here, so I think exactly the same as you do. It's a great city by the Mediterranean, good weather. Um, Trying to make efforts to stay there, to be innovative, also within my field. I think the city is making great efforts to boost innovation for startups and in particular the healthcare sector. So I'm happy to hear. After having lived in Amsterdam, Milan, and Boston, moving back here was not a downgrade at all. Actually, I was glad to be back.
Yeah, I believe that. I mean, Barcelona has such a beautiful beach, and it must be amazing in summer.
It is nice. It is nice. Yeah. Actually, I'm enjoying this currently this during the weekend this month with my family.
Yeah, I believe that. Jordi, let's talk about your career in healthcare, in particular in impact.
I lost you. I lost your voice, Christopher.
Oh,
Okay,
so
now.
let me just check.
You,
The right microphone is on. I hope it works now. Okay, there was
yes, yes. Now
obviously
it works.
something. Super,
So if you don't mind
super.
repeating.
Let's look at your career. Let's talk about healthcare investing. What is the driving force behind your career in impact investing, especially in healthcare?
Well, good question. I always say so. I think my career has a two is a twofold career. On one side, so I'm an economist by training. I started my career as a financial advisor at one of the big four firms at Deloitte, where I shaped and I contributed to one of my natural skills, which was analysis. I'm a highly analytical person. On the other hand, I'm also a people person. I like mingling with people, meeting new people. I'm also a very curious person. Once I know about something, I always want to dig deeper and know more about it. So being in an investing position or in the investing sector it fits very well with me because it merges both of my natural skills, the ones that I have also professionally shaped the most. Because after being a financial advisor, I jumped into the pharma sector, the life science sector, actually within different companies within the sector, always in the business development slash corporate development positions. So I think I'm making the most out of my qualities. And impact investing in particular, believe it or not, came out of coincidence to me. I was networking, so I had a very clear intentionality to jump into an investing position, either in private equity or venture capital. I happened to meet my current bosses, the founders of Ship2B Ventures, and the way they were speaking about healthcare from their impact angle sounded very much with what I wanted to do, or the vision I had, which is a value-based healthcare vision, right? So the system is broken, right? I mean, it's no surprise. Everyone knows about it. Everyone speaks about it. There's not much done yet, but everyone knows that the system is really broken. We cannot afford it anymore. It's a system that was built mainly for acute diseases. Now we are all living, aging more and more, and living more under chronic conditions, and it has to change. And when I was living in Boston, I was lucky to do a course on value-based healthcare that really changed my mind. So this. Hearing this from the impact perspective really got me. And then there's a second point that when you think of impact investing, your lenses or the scope in which you look at things is slightly different, because you position yourself, or at least at Ship2B Ventures, we position ourselves with a scope that is, rather than being at a cell level or at a microscopic level, or at a pathology or technology level, we look at things from the person perspective, not even the patient perspective, but the person perspective. And beyond this, we look at things from the planet perspective. And when you change perspectives, you see things quite differently. And this is very interesting. And this is what really got me into impact investing.
Yeah, that's an amazing story. So you had several positions. You are not a biochemist or biologist or chemist by training. You're coming from the economic side.
Exactly.
What sparked your interest in healthcare? When coming from the economic side, there are many areas in the world where you can contribute. Why did you decide to go into healthcare?
Again, I think it was by coincidence again. So I was, as I mentioned, after graduating, I started at this financial advisory position in the transaction department of a big consulting firm. At certain point, it became clear to me that I did not want to pursue a full career there. I did have these analytical skills that I wanted to keep, but I wanted to pursue a more human related or business related activity. And it was just by chance that I met this person working at this Spanish pharmaceutical company who was looking for a person with my background, but wanting to explore or perform more business development activities. It happened to be a pharmaceutical company. It would have been anything else. What got me though was I mean, working in a sector or an industry that has a purpose per se was very inspiring. And then the more I expanded my experience, the more I learned that my knowledge was very, very limited, right? So it's a sector with extremely smart people developing extremely cool things. I mean, it's a very innovative sector that drives basically the well-being of the society. This was also very inspiring. But most importantly, it's a sector that is extremely complex, and I do like complexity, and understanding this complexity and trying to see how how to develop products in a very expensive way, and how to bring these products to different markets. When you bring them to the markets, how do you deal with regulators? How do you deal with payers? How do you deal with prescribers? All different stakeholders, and in the end, all helping to the patient, which would be the user, right? So this complexity was actually very catchy to me. So I think I after 2 years in the sector, I decided that this was a field in which I wanted to expand my knowledge because it was an extremely difficult one. By learning more about this one, probably I could extrapolate my learnings into other fields if needed. But it never happened because I stayed there. After this, I joined a biotechnology company, and after that, an in vitro diagnostics company, and kind of I got my knowledge got broader and broader, but within the life science sector, and I would like it to keep it as is moving forward too.
Is there anything more complex than biotech industry-wise? I remember my first touch point with biotech in 2006. It was a Novartis spin-out. And the first investment case that I calculated was we need about 1 billion to bring this thing to the patient. And coming from other industries, 1 billion is a lot of money. 2006, in 2006 euros. Let's talk about Ship2B Ventures. What's your investment approach?
So our investment approach, as I said, we are impact investors. We look at things at a different, with a slightly different lens, I guess. As any other impact investor, we have mainly two verticals, which are healthcare, which is the one that I'm leading, but we also invest in climate-related projects. Within healthcare, instead of focusing in particular pathologies or investing in specific technologies, we always say we are pathology and technology agnostic, and we want to invest in solutions that improve quality of life for specific vulnerable populations or vulnerable groups that we have identified. And we have identified mainly three, which are elderly people, people living under chronically limiting or debilitating diseases, and kids, pediatrics. Actually, as a matter of fact, we are now in the process of creating a fund specific for pediatrics. So we kind of have spun out this pediatric target from the main fund, which I am working at right now, which is the B Social Impact Fund 1. And we are mainly focusing on elderly people and people with chronic diseases. At the same time, we try to bring a different angle here, which is that these people are living in a planet, and we're bringing the One Health concept here. And in order for these people to be healthy, there are many things that we can do, and we look at their physical health, their mental health, social health as well as purpose in life, which is because there's a lot of correlation between having purpose and healthcare and well-being in general. But we also try to look at a slightly larger scope angle, and we also look at the climate environment that people are living at, and we do take into account this particular climate-related measurements as well within the healthcare investments, and I think this makes our investment thesis pretty compelling. We actually call it theory of change. We don't call it investment thesis. We call it our theory of change. There's a situation currently in the in the world we live. We have identified specific things we think we can contribute to changing. We have defined them within our thesis, and actually we have the current situation, the change we want to provide, and what will be our role within this change, because we cannot, our role will be, of course, limited, but at least we know to which magnitude we can or we want to contribute to this change.
Big dreams are always a good starting point. Just look at Elon Musk with Tesla and SpaceX. So nobody believed it's possible what he did with SpaceX. I totally agree to your investment thesis or theory of change, like you call it. As far as I understood, what you said is you, on one hand, look at the macro level. You look at what's going on inside people. Why do they become diseases? Why do they get sick, and how can we cure that? But also are aware of that potentially many of the risk factors are not in the body, but in the environment outside the body, which also broadens your vision then. When you look at these two areas, what are the big challenges in both areas that you want to tackle with your funds? What problems do you see that we need to fix?
Wow, this is a very good question. So if I may, so our thinking process is that we start from the We start from the planet, we go to the person. From these two groups that I mentioned, the elderly people and people with chronic diseases, we constantly research in what are the most pressing problems for these people, both healthcare related, but also socially related. And then, and only then, once we get into the disease or healthcare, both physical or mental healthcare level, then we go down to the micro level. But it's always keeping into perspective what will be the outcome in the let's say in the person level. What are the challenges? It's a nice question. The first challenge would be referring to what I said earlier. The system is outdated. I used the word broken earlier. I would say it's outdated now. It was established. I'm speaking now about the European healthcare system. To some extent, the Western healthcare system, also in the US, although it's private, it has kind of the same problems. It only activates once the disease is present, right? And this is acceptable, or this is good when most of the diseases are in an acute level. You are in, then a few days after you're out of the system, not a big cost. Hopefully you've been cured and you can continue with a healthy life. When most of the diseases become chronic, and when the life expectancy keeps growing and growing, this system is not working anymore. And the main solution is, and we all know about it, is in most of the cases, prevention. Not all of the cases, but a good chunk of it is either prevention, early diagnosis, so on and so forth. The main challenge that we're finding is that although there are good attempts and a lot and technology is providing a lot of opportunities for improvement in prevention, the system just doesn't reward it yet, and there's no money driven towards prevention, and we are making the treatment ball, the after the disease ball, larger and larger, which is good. We're curing more diseases, but I wonder whether if all or part of these efforts were put into prevention, what would be the outcome, right? Would it be better than what we're doing right now? And I think this is a challenge we're having now. So it's kind of the imbalance, or the way the payers are paying for solutions might not match the course of the disease, right? Maybe potentially people could be better off on the longer term if we were to put more efforts in prevention. So what would be that would be the first one. The other one is very much linked to this angle, to this broader perspective, right? So not all the solutions are in the biology level, or all the micro level, or the healthcare level, right? There was one of them I mentioned earlier, where we're constantly doing research within our two scopes of population that we want to help. And one of the first interviews I did to a physician, actually, it was a well-known physician, head of a ICU surgery in one of the main hospitals here around Barcelona. He was retired. He was just retired. But after 30 something years of practicing, I asked him, what's the most disruptive innovation you've seen when practicing? What has been the one that has created the better outcome to the patient? And this guy said, okay, well, there's one thing I can clearly identify as the best innovation that has ever happened in my life as a physician. And this disruption made our death rates in ICU drop in a tenfold, just from one day to another. And this disruption was, interestingly, was when the government made the use of a helmet mandatory when riding motorbikes. So before, Barcelona is a city where there are a lot of motorbikes. This physician, as a head of a surgeon of an ICU, was receiving a few cases per week of motorbike accidents with people who were not using an accident, and most of these accidents were fatal, right? That people were not surviving these accidents. After people were able to use their helmet, he was receiving the same number of accidents, but just these accidents were not fatal because the brain, the head was not injured, so they might have affected other parts of the body, the arms, the legs, but these people could get out of it at a very much larger scope. So the most disruptive, the thing that made his numbers change the most was not even in the healthcare industry. And here's also when I was talking about prevention, if we change the scope, we are able to identify other fields that might not even be in the healthcare field that can have a dramatic impact into people's lives. And I think this is also a challenge we have because we tend to, and I myself, I fall into the same trap constantly, and I see it all the time. So we are back to the biotech projects or whatever. I keep seeing projects that are focusing on the cells and how the cells are interacting between each other and what are the effects, what is the toxicity, so on and so forth. And that's fine. But if we were to think from the theory of change, from the person perspective, would we still be investing so much money in these solutions? Wouldn't we be changing a little bit our the way we think, and therefore the solutions that we want to identify to bring to the world? And this is the other challenge I face. So it's probably the way that system works. I don't know if this makes sense at all, but it's a challenge that I do.
I think to your question, it depends on whom you ask. To me, it makes totally sense. Let's dive into this prevention aspect a little bit deeper. I'm very passionate about it, and I totally agree with what you said, that the endpoint is a disease, but the causes of the disease might be somewhere else, not in the chemistry lab, not with the lab technicians. When you ask a biotech entrepreneur, of course, they're looking at the micro level and don't have a perspective on the macro level. What you mentioned, what you described with the surgeon, a policy change basically affected the outcome of the patients tremendously. And I think also when we look at prevention, this is the case. However, the problem, whenever I tried to address this aspect on the investment landscape, the problem simply was, and how do you turn it into a product that we can sell so that we can create returns? Because investment is also about making returns it's not a charity. And the investors I talked to always said, look, when we can simplified model, when we can produce a pill, we can sell it at scale, and we can create returns so we can invest in the next generation. When we suggest and support lifestyle changes, we are in the area of philanthropy because it's usually consulting. You can't scale it. It's very difficult, and it's not an investment case. It's important, but it's not on the scope of the biotech investors. My question to you now is, how do you see this area of prevention? Where do you see investment cases in this area that you as an investor can make an impact and also create returns? Or is your fund set up in a way to say, okay, we don't care about the returns, we want to create impact?
So our fund does care about returns. We are impact investors, but we want to act as a catalyst between regular investors and impact investing. This means that the money that we aim to attract is money that is looking for competitive returns, market rate returns. So we do look for returns as well as the impact. Actually, it's at the same level. That's on one hand. On the other hand, we are, as I said, we are technology agnostic, so we can invest, and we do invest in any space within the life sciences sector, but also out of the life science sector. And I would say we invest roughly 2/3 within the life science sector, and this would mean biotech, medtech, diagnostics, even digital health. But also we have roughly 1/3 that can be invested out of it. Prevention is our one of our main drivers within our theory of change, within our thesis. We do have some investments around prevention, but I do agree the business model is not there yet. I think technology-wise, especially digitally technologies can be catalyzers and can be enhancers of prevention model or even monitoring model, early diagnosis model, at scale and at almost a marginally zero cost. But the business case is not there yet, and I usually compare it to 20 years ago, when all these big tech companies were using data and were serving users without a clear business model. Their case was generating the data and getting the data and understanding people. And only 15, 20 years after they were created, then business models were created around that. I think, I mean, healthcare potentially will be a similar case, right? The thing is that we're not even there yet, meaning that we still have to create this or to see these platforms that can generate data, being my biomarkers, being whatever, probably at a no return level, or without a clear business model. And once someone has all this access to this consolidated data and can correlate and can really drive meaningful outcomes out of it, then we will see business models that probably don't exist just today that will shift towards these prevention models. But nowadays it's difficult to identify these projects, and we are looking at them at a more let's say with a narrower scope than what need to happen in order to have this implemented in a mainstream level.
Let's look at the data side. You mentioned that data is important to identify biomarkers, and the digital space might provide some solutions here. Can you give more detail to this thought? Which solutions do you see these days, and how can generating data help scientists understand how diseases evolve, develop?
Yeah, I think there are there are three main fields, probably more, but I see, or what we see at Ship2B Ventures, there are three main fields in which digital technologies are helping scientists. The first of all is in drug development, and which, by the way, is not one of our fields of expertise of interest, but we do see a lot of, I mean, when we do our research and during our deal flow, we do see a lot of opportunities in here, because as you mentioned at the beginning with your Novartis project, there could be a lot so this could gain a lot of efficiency, right? It could dramatically cut costs, it could dramatically cut time to market, and it could potentially lead to better treatments faster and cheaper, mainly. So this is definitely one of the fields. The other one is getting more efficient at a provider level, rather than at the treatment level, at the provider level, helping healthcare centers, helping radiologists, helping physicians, helping nurses, helping remote care. All these things, they could make the system more efficient. Therefore, we could reach more people at a lower rate with fewer providers, which is actually one of the trends that we're doing. And the last big trend is actually one that is maybe not the most sexy right now in terms of investment, which would be the digital therapies, right? Either through cognitive behavioral therapies or through other type of therapies, digital technologies might be, in some cases, might be a good solution for specific pathologies, in terms of having a decent treatment. I mean, probably at levels that are equivalent to current pharmacological treatments, in some cases better, but also in terms of accessibility. You could scale these treatments basically anywhere in the world at a almost zero cost. So you could very easily reach rural areas or areas with difficult access, and solve problems that are currently unsolved. So this would be the third leg in which I see a lot of opportunities. It is, again, I think there has been kind of a now maybe this third leg is not the one that I am seeing more enthusiast in from the investment perspective. But precisely as impact investors, it is the one that we are putting more efforts in investing, because we do believe that there's opportunity here, and we want to support it.
Yeah, it totally makes sense. I think the big question is, do we understand diseases really, or do we really understand diseases, or do we lack data? And it was a panel discussion in 2019 where Christopher D'Souza, an investor from the United States, said, in the past, we made decisions based on 200 or 300 data points, and drugs were approved. And he brought then the example that he said, a minute now, look at Fitbit. Back then, they did a sleep study, and he said they have millions of data points. And then he raised the question where he said, just think about it, what that means for drug development when we could generate so many data points, and what it means for the scientists. 200 data points compared to millions or billions of data points. How much further are we on this journey? You said that you have more insight into the digital area. How is the data generation evolving in biotech?
It is evolving. It is probably still in its infancy. There are challenges. I mean, it depends on the field. Some fields are using even advanced computing methods and are generating millions and millions of data points to identify, from diagnosis to drug development, to enhance and to provide better solutions out there. I think at the provider level, though, there's an issue of interoperability of data. The data is still in silos, and is difficult to create, and databases are very hard and costly to generate, and data should evolve in this direction. Data should become operable, interchangeable, should become easily accessible to everyone, and I think it should evolve this way, and I think it's evolving this way.
Yeah, it's good. It's good to hear. So that we go beyond Apple Watch, and that also more is going on. At Bio Europe, you were at the panel talking about sustainability and healthcare, and you're very outspoken about the healthcare's environmental impact. And this was also the reason why I said, come on my podcast. I have not thought about this before I saw your panel. My question to you is, in your opinion, what's the most alarming fact in the healthcare system when we look at the environmental impact of the entire system?
That's a great question. Thank you for bringing it up. I think I like this topic. We should speak more about this topic. The most alarming fact is that when we speak about sustainability measures and climate change, or even when we speak about impact investing, ESG, whatever, investing or ESG sector, usually, and I'm seeing it, I think it's changing fast, but it's still most of the cases, healthcare stakeholders in general don't feel accountable, or don't feel like the climate issue is their business, because we are in the healthcare business, and healthcare is about improving people's lives. We are already creating a good impact, right? So why should we bother? Why should we care? We are already contributing to a better world. Well, I agree. First and foremost, I do agree. But it turns out that in developed countries, the healthcare sector is contributing in 4% of the total emissions, 4 to 5%, depending on the source, but roughly 4% of total emissions on a yearly basis in developed economies, and it's up to 10% if you calculate it in indirect ways. So turns out that the healthcare sector is contributing massively to CO2 emissions and to climate change. So it is our business. Of course, our business is about improving people's lives, of course, and this should be the primary outcome. But what if we started just measuring the CO2 impact? I mean, I'm not even talking about decreasing or taking action, but just measuring what's the CO2 impact. But I'm convinced that only by measuring what's the impact, we would immediately find easy ways to reduce them by a good chunk without affecting at all at the care level, right? So I think it's something that we should speak about more and more, and this is why and you very kindly named this session like you did, right? First, do not harm, which is the main principle in medicine. You don't want to harm the patient, but you don't want to harm the planet either, right? So we should think about it again at a different perspective. So yeah, probably the most alarming thing is that usually people don't feel involved with it and don't feel accountable with it. And part of what we would like to do is to draw the attention of all the investment decisions that we also make. For instance, a lot of business models depend on disposables. A lot of the APIs that are produced within the pharmaceutical industry are not even produced in Europe because they are polluting. There are certain things that it would be good if we just had them in mind. I'm not even talking about taking action, but just by having them in mind, we would certainly look at things a little bit different.
Yeah, I totally agree. First, do no harm. You mentioned this in the question, yeah, and I immediately picked it up because I said, okay, this is such a great statement. Charlie Munger, in his book, I'm currently reading his book. It's Poor Charlie's Almanac, where his greatest speeches are collected. And it was, I think, in 2003 that he said, we have today the problem that people don't think about second or third or higher order consequences of their actions. They just see what they're doing and see the first order consequences. And first, do no harm, in my opinion, is exactly expresses that. Let's think about what consequences do we produce. And I was not aware that the healthcare's contribution to global CO2 emissions is 4 to 10%. Why is there such a variety in the data? You said on one hand it's 4 to 5%, but when you calculate it more indirectly, it's 10%.
Yeah.
Can you explain this a little bit more?
So it depends on the source again, but it's basically if you calculate directly what the healthcare stakeholders are producing would be roughly 4 to 5% again, depending on the source. If you calculate indirectly, so there are three scopes of CO2 emissions, right? So you have the direct, then all the economies that work indirectly for this economy, and then there's even a third round out of it. So if you take the direct and also all the economy that is around the healthcare economy, if you take these two, you will find the 10%. Does it make sense?
Yeah, I think so. So what we can say is that the healthcare system is a massive contributor to global CO2 emissions, and it's worth addressing. When we look at the future, could you paint a picture of a truly sustainable biopharma industry? What key changes, in your opinion, are necessary?
We will definitely go that route. And this is why we are at Ship2B Ventures, we are taking into consideration this because we believe 10 years from now, regulators, patients, providers, the whole system will require some type of CO2 emissions control. Looking forward, and this is beyond 10 years, I am seeing, and there are already a few cases. So on one hand, I am seeing, and I expect business models more dependent on circular economy, so less disposables and more reused materials, and businesses related to that in sterilization and refurbishment and these kind of things on one side. And on the other side, I think we will be more careful in the sourcing of raw materials as well. And we're starting to see some examples in there, but probably just as other companies in other sectors are doing, pharmaceutical companies and the healthcare sector in general have to trace their CO2 emissions from their sources, from their providers to their customers, and just by tracing them, there again, we will see new opportunities of doing this slightly, taking care of the CO2 emissions at probably similar costs, and we will see this shift for sure in the long term.
Yeah, the movements of goods throughout the world are wild these days. I mean, on one hand, it's good because humanity started collaborating on a global scale.
Yeah,
On
for instance, I mean, you see big tech companies, they say, 70% of the materials of this device are made out of recycled materials. Our providers are audited and they fulfill with this and this and these audits and these good practices, so on and so forth. Large pharma companies are starting to have these programs. I think they will just become mainstream, and even regulators will start demanding for this type of measures, and this will make the whole industry more conscious about it.
how much room for improvement do you see in the logistics? I mean, currently a lot of products are produced in China, in India, and shipped around the world several times. How can we really change the supply chains and still be cheap for the patient?
I'd say that's beyond my knowledge. Yeah, I think this really overpasses what we are doing at Ship2B and the type of deals and the type of research that we're currently doing at Ship2B. I'm thinking of very punctual cases that have brought my attention, that I have read recently. So speaking again about the supply chain, if regulators and companies and ultimately patients and users are serious about having this traceability down to the source, there should be room for improvement there. But this is just an hypothesis, and I'm sorry I cannot provide a clear answer to this question. Not my knowledge.
It's just a normal conversation. We don't need to dig in the data, but I just can imagine that there is a lot of room for improvement in optimizing supply chains to drive emissions globally down. It's just without having data really at hand, but from the
logic would say that there's a huge room for improvement there. Huge room.
It would make sense to look towards that direction.
It would definitely make sense towards that direction, absolutely. As a matter of fact, in our climate vertical, we are looking into this type of getting more efficiency within logistics, not healthcare related exclusively, but also broadly. Yeah.
But I think for an economist, the problem then is always, okay, I mean, when we change the supply chain, there is, an example, some initiatives going on in the chip industry to start factories in Europe and in the United States. The chips are not shipped around the world again. But then there is always the argument, yes, but it will drive the prices up, and then we lose our competitive edge. What's your perspective when you look at the biopharma industry, pharmaceutical industry, and also the other industries we work with? How can they use it as a competitive advantage? Let's come from the positive side. When we change these systems, how can we still be competitive and use it as an advantage?
So there are two things here, and one of them we have been speaking about it throughout the whole conversation, which is that there's a lot of potential efficiency to be gained within the sector. It's a high cost, high margin sector, that, for instance, in the US only, 25% of the healthcare costs are driven by administrative tasks, right? So
Really.
what if we were to reduce this to 15 or 10%? I mean, there's a huge improvement there. Then we spoke about these digital technologies or these new technologies that can potentially improve the drug development costs and phases, right? So we will gain efficiencies for sure. So there might be room for a reorganization of costs. There can be, especially if we redefine costs. So there are some initiatives that suggest or that invite companies to include environmental costs within their books, within their financial books. If this is in its infancy, there are some attempts that are out there. Some of them better than others, some of them more criticized than others. But what if we start implementing this? All of a sudden, you might have cheap products that will become very expensive because we will account for a huge CO2 emission cost or transportation cost or environmental cost to them. And then these companies might have to pay additional taxes or might have to be penalized somehow, right? And this eventually will make this transition towards local production. I'm just making this case up, but to local production, for instance, more economically interesting because it will represent an economic savings as well. And we're seeing this, for instance, I mean, when we see sugar-based drinks, right? How can this be that these drinks can be as cheap as water? Or how can water be in some cases more expensive than sugar-based drinks? Well, if we start taxing accordingly, or we start requiring prices to these drinks according to the actual effect they provide to people, and they really become more expensive, then we might have a different behavior, both from consumers and also from their manufacturers.
Yeah, it's an interesting development, especially when we look at drinks. I think from the healthcare perspective, sugary drinks might add something to the problem that we see today with obesity, diabetes, and all the diseases that are connected to that. But it's the cheapest drink, basically. Whenever I go somewhere shopping, how can that be?
It's the cheapest drink, it's the cheapest food. Obesity is related to social and economic determinants. And how can it be that the cheapest food is the most unhealthy?
But isn't I mean, when I come back to the supply chain perspective, isn't that amazing? I mean, it's a complex product. A sugary drink is not a simple product. It's not like a sort of tea or just water. It's complex. It needs an industry. It's manufactured. It needs logistics. It needs distributions. And usually, when I just follow my gut feeling, would say, okay, this must have a high price. But the industry was capable of driving the prices down to make it the cheapest product available, and it's logical that people buy that then. So this is just what I wanted to point at. It's maybe also in the other supply chains, there's a lot of room for improvement. We just have not thought about it. When we look at the unhealthy food on the market, it's cheap, it's accessible, it's abundant, it's everywhere, and the supply chain could organize it. And then we see the other areas like healthcare, where we have the concern it might drive the prices. We say, okay, why don't we think about it? How do you see that?
I mean, it's a great angle. I fully agree. I fully agree with you. I mean, it's about determining logistically how we can improve things. Probably there's a parallelism with healthcare, right? There's a way of doing things massively at a very cheap cost, and then all of a sudden, many players within this field align, so they can help each other, they can finance each other, they can make things cheaper and more accessible to everyone. And in the end, these are the ones that are winning nowadays, because we are only rewarding from the financial perspective. This
Yeah,
would vary a
yeah,
little.
I think it would help when policymakers start thinking in higher order consequences. I mean, I understand that in the 70s, for example, I mean, I grew up in Austria, and we still were in the aftermath of the Second World War. I'm close to 50 now. And when I look at the tales from my parents and grandparents, it was basically scarcity. So they had a problem when they did not rebuild their houses in the 40s and 50s. They would either starve to death or freeze to death, basically. I mean, it was mountainous area in Austria, so it's really cold. Um, from that perspective, I understand the rise of industrial food in the 70s. You need to feed people. You need to provide cheap food to people. But now we are 30, 40, 50 years later, and we see the consequences. And still, it's the cheapest food on the market. And what from your fund, you said that your fund operates in both areas, macro and the micro level. What initiatives do you see on the market to flip that so that we really get make systemic changes? Is there anything going on, or is it still just a blind spot where we don't look at
There
this direction?
are there are big trends. First one is that consumers, people are demanding this. People are, and we're seeing, are willing to pay a little bit more.
Mhm.
Certain people are willing to pay a little bit more for healthcare, for either healthier and or more environmentally responsible products. And we're seeing this everywhere. And this is becoming also a part of the selling proposition of several brands. So consumers are changing. This is making companies change as well. And all of a sudden, companies are now more aware and more willing to implement government's measures to create more responsible products. Now we are seeing companies that are offering larger product warranties. Instead of changing them, they are offering larger warranties and larger free repair services out of consumer changes, basically. But there's one important driver here, which are regulators and governments, which can dramatically affect and impact the way industries are making decisions. And we are seeing with the 2030 objectives, with the different objectives that mainly developed countries or European countries are leading, that are helping this transition. And just as the parallelism you made, I mean, 40, 50 years ago, the problem was the lack of food, and people were freezing and starving, as you said, and the whole system, the whole economy aligned itself to make sure that every single person in the world could have food, at a very reduced price. So potentially, and because the humankind is a very smart being, potentially now that we are in the opposite position, in the position in which we do have food, and it's about now having good food so we can have better lives. And for some reason we're speaking about food, but we could speak about medicine, treatments, anything, healthcare. We will find our way towards that route. It's about time and about aligning stakeholders. And to me, there are these two main stakeholders, which are people and regulators.
Yeah, absolutely. I mean, regulation is not always a bad thing. There are also good parts to it.
Yeah.
And when I look at how Europe evolved since 1945, I mean, basically, Europe was completely destroyed after World War II, and we solved so many problems, and I think we can do that. However, some people think that investors are always the bad ones who just try to play the system. And when you look at social media, the system is rigged and favors the rich, and the rich just get richer, and they just rip off everybody and destroy the environment. Let's talk about the role of investors in sustainability. What role do you see for investors in that game so that they also make a positive change? And we step away from this old industrial investment cases. It's always, I think, the white fat man with a cigar depicted. What role for an investor do you see?
That's a very interesting thing. So within impact, there are impact investing has three pillars. It's intentionality, and we spoke about theory of change. Also, by the way, the intentionality of the founders or investigators. There's additionality, and also, of course, additionality of the solutions, clinical needs, so on and so forth, but also additionality of the investors. And then there's the measurement, which is how are we tracing these potential changes. So the way we believe impact investors can provide additionality is and I think I said it earlier as well, is by acting as catalyzers, but by acting as investors that act as any other investor that can co-invest with any other investor, and basically they make decisions considering these things, right? These key things, and bringing them to the table on the advisory boards or on the at company levels, sharing this information with other investors. Hopefully having financially successful cases that also make people change their minds in terms that there's no necessarily a trade-off or a large trade-off between an impact company or a purposeful company and a financially successful company. And we see ourselves as a catalysts in this sense. So we see ourselves as catalysts for the money that we are able to raise and to catalyze within these investment criteria. And we see ourselves also as catalysts with our co-investors, because at the end of the day, they probably see that we are equally looking at financial return just as them, but in addition to this, we are considering some other criteria that might or might not inspire them, but there's room for everyone here. And ultimately, we are influencing founders and startups in the way that they now know that there's another type of investor they can knock the doors out, but there's some checks that they have to fill, and they start preparing towards those checks. So I think we are in the very early stages. This for sure impact investing is already evolving a lot and very fast, and will evolve and will ultimately become mainstream. So there will be a point, and probably we're not far from there, in which investors will not call themselves impact, right? They will call, I don't know, it will be much more specialized, and it will be already incorporated within the criteria. But at this moment, probably we are acting a little bit as loudspeakers and facilitators.
Yeah, no, I couldn't agree more. I think investors are a very important catalyst in the industries, making things happen and challenging founders to think about finding customers, to think about driving costs down. We brought the example of the food industry before, and I think this is what investors are doing. Elon Musk is one of the best examples, in my opinion. I mean, also with Tesla, without him, I don't think that electric vehicles and solar would be where it is today, cost-wise.
Exactly. Investment. Yeah, I fully agree with you. Yeah. Electric vehicles were an odd thing before his vision, right? And now it's just a mainstream thing.
I think the first time, I can't remember, I think it was probably 2004, 5, 6, 7 or somewhere, or 8, where I read about Elon Musk. I think many people laughed about him. I mean, electric vehicles, SpaceX, it's just not possible. It's too far in the future. But he found investors. I read his biography, and he found the right people who backed him and believed in his entrepreneurial spirit, believed that he will find customers, that he will evolve the technology, and that he will drive costs down. And I think, in my opinion, it would be interesting to understand the thinking of the investors who backed him, but I don't think he would be where he is today without investment capital.
I fully agree with you, and I think it's a bright example, and it could be very inspiring as well for our industry.
When we talk about the ecosystems, before we dive a little bit deeper into your fund, you lived in the United States and in Europe. And it's just my personal bias, my personal opinion. Whenever I look at Europe, it seems like it's a desert. It's like basically investment capital is still dead in Europe compared to the United States. I exaggerate, of course. You experienced both ecosystems. How do you see both ecosystems? What are the advantages and disadvantages when we think about impact investing and investing in general?
So okay, interesting. It's the same name for different industries, I would say. We are okay. So first and foremost, venture capital and venture capital investing was born out of the US, which is a free market, a very large one, mostly private, that has a mentality of of innovation and in which capital is invested towards innovation at a much larger stake or share of total wealth than it is in Europe. So we are talking about, it's also a land of second and third opportunities. People have a different mentality. So long story short, it's a country of possibilities, in which it is, if you have the right product or the right company, you can scale relatively fast at very high evaluations. Europe is culturally different in terms of first and foremost, it's not such a scalable market because it's very fragmented, not only at a border or regulation level, but also at a cultural level. It's quite fragmented. It has a history also of looking local. It's a market that has higher regulations, and where wealth has been historically distributed in differently in different buckets, where historically um, innovation or let's say alternative investments have not been so popular as in the US, and in which I would say the main investor in innovation is the European Union through its different vehicles, right? And of course and of course it's a market that is not as mature as in the US. So this makes the whole ecosystem, I mean, just different, and we cannot apply the same criteria in both markets. We simply cannot. Luckily, excuse me.
Bless you.
Thank you. Luckily, we are in the process of shaping and defining, and this sector in Europe is getting more and more mature, with more and more success cases, with more and more alignment of different stakeholders. Luckily, also in healthcare in particular, there has been a lot of innovation. There's now an amazing and incredible level of science and scientists at a very efficient cost, which is very attractive. So I think we are in a place that has a huge potential, I mean, in which the potential of scientific healthcare innovation is really, really good. And I think we know this, and we are getting organized as an industry in this way. The bad thing of this is, once companies or projects get at a decent level, then the best scenario, or almost the only scenario, is to move them to the US, right? Or they get acquired in most cases, in a large majority of cases, by US companies, and then they get developed and implemented there. Hopefully this will change as well. Hopefully we will get mature as an industry, and we will be able to get more companies or retain projects larger in Europe, hopefully, so that this trend changes. But at this moment, I think we are a great source of origination, and we have to take advantage of this. And then unfortunately, at some point, we all know that for in order for the projects to be successful, I mean, financially successful, we have to look at the US as a market.
I agree to everything that you say, so I can't disagree to anything. I just don't understand where Europe lost its edge, and I have brought this up at several podcast episodes because I would really like to understand what changed and how we can shift it to the better. I think it's undeniable that in many industries, the United States just skyrocketed and left Europe behind. When I studied economics in mid 90s to late 90s, it was the time when Europe deregulated, when the countries really kicked off the European Union as we know it today. And it looked to me, when I think the great innovations back then, automotive, uh, the European car makers were, I think, top at top globally. The mobile industry, top level. Science always, when you look at also the US companies, I mean, they have many products that originated in Europe in their pipeline. And the entire healthcare sector and pharma sector also thrived in Europe. And it looked to me like from after the year 2000, the big dot-com bubble crash, I don't know where the European Union developed and evolved, but now I see this huge gap between the United States and Europe. And as far as I understand, you see a similar gap. So that's venture capital, investment capital, and also moving innovation forward. Entrepreneurs in Europe have a little bit of a disadvantage comparing them to the US entrepreneurs. And many European companies then must relocate to the United States if they want to go into a Series C, Series D IPO. We can't do that in Europe. When you could change that, and you could wave a magic wand and tomorrow everything would be better, what would be the 3 measures that you would recommend implementing?
Wow. Well, the first measure would be a unified healthcare market. Beyond, I mean, even at a even at a let's say price and go to market level. First and foremost, with unified data usage, with unified coverage. I mean, the whole thing all together, not just you know, the regulatory approval. The second would probably, and I think the second one we are in this direction. It's about having the industry matured, having more success cases, more larger funds or players betting on local projects and keeping them here, and hopefully some of them launching them here. And the third one, I guess, would be in the it's also regulation, but I think we should make things more attractive for companies, for the private sector in general. So the private sector wants to be established here and wants to stay here for some reason. So that I'm talking about the talent now as well, both the large companies and the talent. It's difficult though because we are fundamentally very different from our competitors, not competitors, but other regions such as the US or China that are now far innovating far more than us, and we are fundamentally different, mainly because of how our system is built, and I'm speaking about social security and all our welfare being right. Yeah, I don't remember now the name in English, but the all the healthcare, not the healthcare, the social care system that we have built with the years is something that is very interesting, but on the other side, it's also limiting in some aspects. And when we are competing with regions or continents or countries that don't have these systems and are more agile and can innovate faster and break things faster, this is also an advantage that is difficult to change.
Yeah,
We would
it's good to me that you mentioned China. I think China is amazing because 1989, 1991, I still remember the pictures from the newspapers where you saw mostly people on bicycles. And when you looked at other regions of China, it looked like they were living in medieval ages. And now in 2024, it's always traveling to the east coast of China is like a trip to the future. And in just 3 decades, this picture changed completely from an undeveloped country to a country that probably already outcompetes the United States in many areas.
exactly. And the United selves themselves, they are also worried about this, right? Because they are trying to figure out how to compete, against these other challenges, and it's going to be very difficult. It's a country that has a market. Again, we were comparing Europe to the US, right, with a larger market. So it's a exponentially larger market than the US potentially in terms of user, with a lot of coming from a lower base, so a lot of delta, right, a lot of marginal gain to be made, and a lot of positive innovation and regulation that is pushing in terms of protection of internal innovation, of many other things. I mean, I'm not an expert, but you mentioned these changes in 3 decades. I wonder how this change is going to be in next decade or in 2 decades from now. It's probably going to be even larger.
I mean, I find Europe's position interesting when I look at the numbers. You have the United States, you have Europe, you have China or Southeast Asia. United States, 330 million inhabitants, about it, citizens. When I look at Europe as a whole, not only the European Union, we have a number of 750 million people. It's a huge market. It's twice as big as the United States, roughly speaking. So it's just simplified. When I look at China, it's 1.4 billion. So it's twice the size of Europe. When I look at the economic power, I would say first I would rank the United States still, second China, and third then Europe as a whole. It was different 3 decades ago. So I think there's no excuse that we can't change it and we can't move forward. There's a lot of potential which is not leveraged yet.
I mean, I'm sure of it. I'm sure of it. Things can always change. It's about how fast can we drive these changes. I'm not sure we can drive these changes that fast, but yes, for sure. I mean, in the future we can make things better. And this is about creating the needs, right? China was in the need of changing things, right? Because their population were needing it. So far, Europe is still in a comfortable position, so probably it's not urgent. It's very established, and it's difficult to imagine that there will be a major change in the whole organization. And you mentioned Europe as a whole beyond the European Union, which is also it has even different challenges, right? So first and foremost is to take care of things internally, doing our best, trying to stay more efficient, trying to capitalize our wealth, because Europe has a lot of wealth. And by the way, by wealth, I also mean the capacity of forming great minds that have the capacity of developing great solutions and great companies, and just make sure that there's the space in Europe to develop them without having others coming in and banning the space, or just acquiring the solutions when they are just too early to prove themselves. So we can still there's room for hope. There's room for hope, and we can still develop our own solutions.
I agree to the point. I mean, Europe has great minds. 750 million. We have great universities. We also have entrepreneurs. I don't think that we lack the talent. I think it's just statistics, and when people are born, it's a certain percentage will become entrepreneur. They have the right personality for that. But you mentioned earlier, and maybe we dig a little bit deeper into that at one point in time, we just don't have the environment in Europe. Can you describe how the current collaboration between US investors and European investors looks like in the areas you operate?
Ernie, mm, So I would say lately, interesting. Um, After the 2021 burst, I think that in general, every single American investor decided to move back to the US and control their own things. Now we're starting to see a little bit more of a little more collaboration again. They usually, I think from the American perspective, they know very well they have a large market in their own, and they look at their early stage developments very closely. And when they look at Europe, it's when it's from a later stage perspective. So when projects that are already picking up, that they know they will be more successful or more financially successful in the US, it's when Americans are coming. And we're seeing, interestingly, there are a couple of or three examples lately. There was well, of course, the Bio Congress has for years now had its own satellites on in Europe, in other regions, in at a country level, even in different countries. But we have seen now the LSI Congress and the RESI Congress, that are American congresses that very recently created their European Congress as well, and probably to look at and to catch projects early. And even in the digital health space, there was this health congress in Amsterdam 1 month ago, roughly 1 month ago, in which was organized by the organizers of the main, or one of the main, digital health congresses in the US. So they are starting to, I mean, their appetite into European companies is back slowly, and we are seeing only by these three examples, this is already a signal that they do see Europe as a source of quality deal flow, just that they look at it at a slightly later stage than most of European funds.
Which makes sense for the United States, because I mean, we have a problem in the later stages anyways. They don't need to finance the early risk, so they can just be passive and say, okay, play with it. And when the stories then get tractions, they can then just relocate it to the United States and say, look, make a subsidiary, put your headquarters somewhere, Silicon Valley, Boston, in other ecosystems, and build it from there. And we give you the capital that you need. And then you IPO the thing, you get rich, and thing is done. Makes sense for the United States. Totally agree to that. Does it make sense for Europe?
How many IPOs have we seen in Europe lately?
Those that we have seen, I think, failed.
It's a different market, as I said. It's a different market. It's about I do think it's in our hands. It's about us creating the right ecosystem, creating more larger funds that are betting into European companies. Public markets, look, I mean, I don't know. I keep hearing that public markets are decreasing. You know, we could look for a better small cap public market in Europe than the one we have. But I think as long as we are able to keep our companies here from the funding perspective, I don't really think it's that important to have a public market or an IPO exit necessarily here. But as long as we are able to keep fund companies at a local level, and most importantly, prevent larger corporations to absorb them, we might have an opportunity here.
I completely agree. I think the measures, when I would sum it up, is first we need to incentivize public and private investors to put capital into startups and scale-ups in Europe. And I think this is mostly politicians and regulatory authorities, that they provide the right environment with tax credits and tax breaks. I see it all the time in the United States. This is what they get as incentive to invest in young companies. It's a tax break. You either give it to the government or give it to startups. And the US favors startups and favors entrepreneurs. And this is something we can change in Europe. We had it in the 90s already. One thing, we need more capital. And the second thing with the capital market, I think an IPO is an exit scenario. And it doesn't really matter whether you IPO a company in Europe or the United States. When the business model is working. So when the company has a solid business model, then investors invest anytime. When you can prove to a US investor, my company does a minimum of 30% return on investment on your investment when you buy the stock for the next 20 years, then you buy it. Doesn't matter if it's listed on in Germany, in Spain, or in the United States. Without that return, an IPO in the United States doesn't help either. But what we really need is we need to motivate people to invest in Europe, in my opinion.
Fully agree. I fully agree with you. Yeah.
When someone listens to this episode and say, okay, I want to create an impact, and probably then picks up the phone and says, Jordi, let's have a conversation. I have a nice impact story. What are your non-negotiables? What are the minimum requirements a company must show that you say, okay, it makes sense that we have this call?
It's interesting. So I would say business as usual. I mean, it has to be a great team with a great at least proof of concept, right? And it has to have a decent market. Beyond this, what we will look at is that their intentionality, and we would work with him, and I would at least grasp his ideas on his solution, so I can identify what's the theory of change. So what's the problem he wants to solve, and there's this very interesting book, Fall in Love with the Problem and Not the Solution. So it's about identifying, okay, what's the pressing problem that you want to solve, and how did you come to this solution as the best one, or as your preferred one to solve the problem? Is it because your expertise? Is it because whatever? Because more often than not, we find solutions out there, technologies that are really, really cool, in the scientific level and not and out of it, but more often than one would think, founders are struggling to find a problem in which this solution will fit. So we want to test what's their theory of change, what's this pressing problem, social or environmental problem that they want to change, how did they come to this solution, and if the solution looks like a viable project, we would go into it. Again, it's about intentionality, about additionality, what's the difference between the current standard of care, and about being able to identify direct measurement in their theory of change, right? So there has to be a direct relation between their solution and the change they want to make. For instance, there had to be a direct relation between the use of the product or the solution and the improvement in quality of the person's health. It cannot be indirect. And I wanted to add to your question that impact is a broad and free word, and this means that impact is everywhere, and impact is senseless without a frame. And I would like to say, if someone picks the phone and calls us Ship2B, of course we will be glad. Please do so. We will analyze projects from our lenses, from what we have defined as impact and what we have promised our investors that we would look at within companies. This doesn't mean that whenever we say, okay, this doesn't fall with our theory of change or with our thesis, this doesn't mean that the company does not provide impact. So impact is everywhere. We can create impact with many projects, and it's about defining impact. And whenever as a founder wants to impact in a way that is aligned with our purpose, then we'll be, if there's a match, we'll be glad. But I also wanted to make the point that impact is free and is out there to be picked up by everyone in their own way, and there are many ways to make the world a better place and to improve people's lives that are way beyond and way out of our what we define impact in Ship2B Ventures.
Did I understand you right? We talked earlier in the podcast about your theory of change. And basically, your theory of change describes the way you see impact. Did I get the right understanding?
So our theory of change is our choice regarding which aspects do we want to create impact on, right? So there can be and there should be many other impact investors or not impact investors that might look out for impacts that are completely different than the ones that we are looking at.
Yep.
For instance, I don't know, we are focusing on chronic diseases. There might be an impact fund that or a healthcare fund that is focusing on acute diseases, and there's a lot of impact to be created there, right? Just that acute is not within our scope. I usually compare this with NGOs because for some reason I think it's easier to understand. So you can make a donation, a philanthropic donation into an NGO that is focusing on oncology, and research in oncology, and another one that is focused on, I don't know, research in Alzheimer's disease, and if you as a person, as a donor, you feel more engaged with oncology for personal reasons, for whatever, you will donate in the oncology one. This doesn't mean that the oncology NGO is making more impact than the Alzheimer one, or that one is better than the other one, or that one is impact and the other is not. It's just that they both want to create impact in different fields. And our theory of change defines the field in which we want to create impact. But you can create impact in, endless of cases, right? So yeah, I just wanted to point this out, that it's not our interpretation of impact or something like this. Is just the field, the scope in which we want to create impact, and which we told our investors that we would create impact in. Does it make sense?
Yeah, absolutely. My next question to you is, your definition of impact and your theory of change is accessible on your website, I guess. So when someone thinks about you might be a right fit, they can go to your website and see this information published. Or is there any other source that you would recommend to look at?
Our website, definitely. It's a bit vague though. If anyone though is seeking to create a solution for elderly people or people with chronic diseases, just reach us, I would say. Or of course, environmentally, which is our other vertical, which is managed by a different team. But anyway.
And then battle test the theory directly in a call. So
exactly.
Okay. You mentioned also earlier that an important factor for you is the right team. My question to you is, what do you want to see in a team when you look at the company as an investment case?
I want to see a balanced team with a balanced and experience in the field they are developing. A team that is very experienced and very sharp, but humble at the same time, and that knowledgeable about the difficulties that is ahead of the team. And I want to see a team that really believes in what they are developing, intentionality again. Because actually, interestingly, empirically, teams that are out there for a purpose are far more persistent than the ones that they are out there for an opportunistic, an opportunity they identify in the market. So we will look at the intentionality as well. Yeah.
So it's less the I want to be rich in 18 months crowd. It's rather the I have hundreds of cancer cases in my environment. I want to change that. I had problem myself, and it's time to change that and move forward. And personal motivation behind it. Just a blunt example.
It's exactly this. Yes, yes. We will look at, and this is actually within our memo, the one we present in our investment committees. There's a whole section dedicated to the intentionality of the founders.
When we look about team development, I mean, I have a background in economics as well. I have a background in merger acquisition and saw public companies on one hand, and on the other hand, I worked with startups. And very often, especially in life science, teams evolve out of university and are experts in their field, uh, but lack other team members, like business, for example, business expertise. When we talk at diversity of skills in a team, how important is that to you? Is this something that should be already there, or is that something where you say, okay, it's an impact investment early stage case, so we will develop the company in that direction? How do you see this problem?
Well, it depends on the type of company. We invest from a very technical scientific companies to business models that are not where technology is not at the core of the project, right? Um, we will definitely want to see, um, we will prefer to see more than one team. It's not mandatory, but it's highly preferred. We will want to see previous experience either in the field or starting new businesses. For sure, there has to be someone that is expert in the at a clinical level with the solution they are developing. So closer to the patient in the sense to the problem they want to solve rather than technically the solution how it's built. Of course, we want someone very expert in there in developing the technology, right? But before this, we want to see someone who is very close to the patient and who has a lot of experience with the patient and knows exactly what the patient or person needs or user needs. Then, of course, some experience with business development is preferable, although this can be incorporated at a later stage. But I would say clinical or patient experience, it would be the number one, then product or technical or technological, then business development in this order.
I like the perspective you bring to the table, where you encourage people to understand the problem first, which means understanding the market, which means understanding the industry operating on the market, and to really have deep insight into this area to understand where a company can make a change and what part of the problem it really is that a small team can tackle. Is this an understanding you would agree, or did I miss something?
That's exactly what I meant. Yes.
So when you look at drug development, I mean, biotech, for example, it's would probably help hire a medical director who worked already in big pharma, who developed drugs already, who has a history of successful filings at the FDA, the EMA.
Yes, but even more important than that would be a doctor that has treated patients.
Yeah.
That would be
Absolutely, absolutely. I mean, when you look at the success cases, you always have this person as a founder, as a co-founder, or hired very early in the development, and this is then the company that gets the investment capital.
exactly.
But
Yes.
it also it's just one example of one industry, but it also applies to every other industry. When a team with a solution
It applies
wants,
to other industries. I mean, we last year we invested into an software specifically dedicated to nursing homes for elderly people. Within the co-founders, one of them has 6 nursing homes and has been in the sector for 30 years, so they know exactly what their customers need, what the issues within the carers are, the families, everything, and the other co-founder was an expert in software as a service development. He had experience in that field, and it was just a perfect match. One of them knew exactly what the market demanded and what was missing, and the other one knew or knows how to build it. So even out of the scientific world, we will want to see exactly this same composition within the team.
can we put this in a recommendation for academic founders? I mean, if I sum it up, it would mean that when a team leaves academia thinking they have the right solution for a problem. It would make sense when we stay in your example with the nursing houses. When the academic team just thinks, okay, we have a solution for nursing houses, it would help first to reach out to nursing houses to find someone who sees the problem and bring this person on board and then reach out to investors with a more complete team. Is this something that would help, or is it not really necessary?
For sure, it does help. And I keep seeing um, some of the founders that I value the most are the ones that at some point they decided uh, to experience what their customers are. So in the nursing home space, for instance, there was a founder that was creating also another solution for nursing homes, and he volunteered as a carer at a nursing home for 3 months himself, just to learn how nursing homes work, how what a day-to-day is for an elderly person living there, what the challenges are for the team, what happens with the family coming in, so on and so forth. And I do value this a lot, because these people are really obsessed with sympathizing with their users and with finding the right solution, rather than thinking upfront, okay, this might be helpful. I'm going to develop something, and once it's ready and it's developed, I'm going to try go and sell it. And it's rather the opposite, right? Okay, I'm going to learn first how things work, and then I will try to develop the best solution. And this is why I'm also I highly value the Stanford biodesign concept, which is exactly this, right? It's exactly going out there to the clinical setting, being in contact with patients, being in contact with clinicians, and then finding the solution. And then once we know how the solution should look like, then we'll put together the right team to do that. But it's important that the idea arises from where it belongs, right? Rather than from a lab or academia or cases that you were describing.
Can you describe the Stanford biodesign model a little bit more?
Well, it's first of all, I'm not an expert in this field. It's a whole master's provided by Stanford, but it's basically it has three processes. It has the first process is understanding the problem. Then there's a second concept that is conceptualizing the solution, right? Once you have identified the problem, conceptualizing and testing the solution within that setting as a prototype, and then scaling it up, right? So it's kind of a three-fold process, very similar to the design thinking that is used also out of the healthcare world. So there's this design thinking framework that has exactly these three same concepts, and it all arises with the source of the problem and then building backwards.
It's basically all back then to what Jeff Bezos said, customer centricity. So at the end of the day, also life science companies need to put the customer at the center of their attention, identify them. It's patients, it's the healthcare system, it's the healthcare providers, it's the doctors. And without that understanding and that know-how, and you also mentioned they should be obsessed about their solution and the problem. Without this obsession, it's not only passion, it's really, they should think 24/7 about solving problems for their customers.
Exactly.
And this is something that you look also in teams so that they radiate the confidence, that they really prove to you in the way they speak that they're really obsessed with their idea.
Absolutely. And when I spoke about intentionality, so this is a key part of it, right? So we want to see what drives them, what do they, we usually not only have business conversations, but we also go out for lunch or dinner, or we spend some extra time. At some point we try to spend a day and a half with them, and so we build also personal relations, and it's in these personal conversations out of the business conversations where you see how's their lifestyle, what do they do in their free time, how do they what is that worries them beyond their company, and you can see a lot of that when you spend some time with people, and we do and within the intentionality, we do want to make sure that they are obsessed with this solution and that they came out with the solution after thinking a lot of the problem and after wanting to solve that problem rather than the other way around, which is what happens in many cases.
Now we have a solution, now we want money. So
Exactly. Or yeah, exactly. Or yeah, I built, I was studying a PhD, I was studying in this, I realized that I could build something, and now it's there out there, and try to find a use case. I'll get there at some point, but it's not. Some cases are good, and we see a lot of platforms in particular that have been successful there, but it's not what we it's what we prefer, right? We prefer the other way around.
yeah, I agree. I think it's a good starting point when someone has a solution or has built something. But before reaching out to investors, it makes more sense to look on the market and find partners on the market who understand also the second half of the company, who bring in really this solution thinking and this customer centricity. And in terms of drug development, it's easy. It's the medical doctor working in big pharma and developing drugs with a history of treating patients and developing drugs. In other industries, it's the same. And then reach out to investors. It's much more impact than just with an academic team.
Exactly. Absolutely.
I'm a huge fan of business cases and use cases. I know that you have probably a little bit of a problem to just pick one in the final part of our conversation. You have many investments and they're probably all great. But do you have one case where you can exemplify your approach that you can walk us through, that you say, okay, this is how investment looks like with Ship2B, where we went in, how it's developed, and how the exit looked like? Do you have one case that you could walk us through?
I would have a few, but out of being polite, I want to mention the last one because also it's the one that I have spoken about the least probably in different forums, and it's a good example actually. It's a very good example. It's a company. It's called Lilian Care. It's a company in Germany that is basically providing hybrid primary care in rural areas across Germany, right? So as we know, there's a big problem in rural areas, both in first and foremost, these areas are getting older and older because younger generations are going to urban areas. And then due to the decreasing number of providers, there are many areas that are without a proper primary care service. And actually, in Germany, only today there are 4,000 vacancies of primary care facilities in rural areas. So this company, Lilian Care, has inspired also by other healthcare systems in other countries. They are developing a hybrid care model in which you don't need to have a physician 24/7 in the facility, but the physician can go to the rural area once or twice per week, and the facility is mainly managed by nursing and physician assistants. And then there's a lot of remote care technology put into that. This company is solving, according to our description of impact, the impact that we want to provide is solving two problems. First and foremost is making care accessible in places in which is becoming less and less accessible. So in these rural areas, so we don't contribute to the urbanization, and we can keep these people, which by the way, most of them are at an advanced age. They can still be well taken care of in their places. And on the other hand, we are helping the system become more efficient, so more people can be treated with the same resources, with the same physicians. And how did we come to it? Well, we met the founders at a congress. It was actually a very friendly conversation. The CEO, the main founder, was completely obsessed about this. Actually, as a matter of fact, he had been working, or he had been dreaming about this idea for almost 15 years. And actually, I know this because when doing our checks, we contacted people that had previously worked with them, and they even brought that into the subject. And his co-founder is someone who had established uh, healthcare or telecare services within Germany at a different company for many years. So both of them had a lot of intentionality. They had a lot of knowledge of the systems that were successful in this field, excuse me, and they had the operational experience in order to make it successful. Um, we just waited and screened the company for almost a year to see how the developments were, how the first offices were established, and just very recently, a couple of months ago, we were lucky to announce our investment in the company, and we are now very happy and motivated to be part of their team and their journey and contribute to their theory of change.
Yeah, thank you for walking me through. You mentioned intentionality when presenting the case, and I think this is something that is not really very often talked about at incubation programs. Maybe we highlight at the end a little bit more why intentionality is so important when you evaluate an investment case. What's your opinion? Why is that important to you?
So yeah, it's three things that are important. It's intentionality, additionality, and measurement. Intentionality is important because it relies to what I said earlier to whether it relies to the probability of the founders giving up or not when they face difficulties.
Yeah.
So if they are intentional about it, it means that they are obsessed with the problem, and it means that they are out there to solve the problem beyond the company. So most likely, if they happen, if for whatever reason the current project happens to fail, because it can, they will most likely start something else within the same field. And this is and because the team is such an important asset at these stages, we do want to make sure that intentionality is out there. And then, of course, additionality is also of absolute importance because of the clinical need and the market. I mean, the adoptance, right? It has to be there. So both things are really important. Just that I think that additionality is kind of, and I always speak intentionality, additionality, because these are impact terms, but we do same terms in the healthcare sector to define exactly the same concept. The additionality part, the clinical need part, is kind of a no-brainer within healthcare already. I mean, everyone looks at it, so probably it's not that additional, although it's additionality, and intentionality for us is really important, and we do put a lot of attention into that.
Yeah, the medical doctor usually has already 2 or 3 decades of experience and already has proof that he invested significant lifetime into understanding the problem.
Exactly. So only the decision of becoming a medical doctor already shows a lot of intentionality.
But this is exactly, I think this is the problem that is not very often tackled in any entrepreneurship program, that people really need to obsess with the problem to attract investment capital for this point, because it's a measure for you where you say, okay, things will go tough. It will be hard. It will be a hard journey. Of course, there are great times. Of course, when the business works, money is pouring in, everybody's happy. I mean, Nvidia, Jensen Huang, he has always a smile on it, but on his face. But when you look at his speeches from 10, 15 years ago, it was not that certain, and it was hard. And he very often mentions it that Nvidia was not only once at the brink of bankruptcy. And without this intentionality and obsession for a topic, it's easy to give up then and say, okay, we are done.
It's a great example. It's exactly what we're talking about. Yes, it's about staying there, even in the hard times.
Yeah, I mean,
Not
vaccine development is another example. I mean, I worked 10 years ago in vaccine development, and vaccine development was basically deemed dead. Besides some people who said, like BioNTech, for example, the founders who said, okay, there is something and we love doing it and we do it. And then they were there at the right time with a developed solution, with a well understood problem when really the problem became global. The others who tried to jump on the train, maybe some made money, but they're all gone now. So now the wave is gone, and all the companies
Uh,
are away. BioNTech not, they're still there.
exactly. They went into the next new thing, except for the ones that are out there for a purpose. Yeah,
Yeah, and these are the founders that you are looking for, basically, as an investor.
exactly.
Right.
Exactly.
When we look at the future in the final minutes, where do you see Ship2B Ventures in the next 5 to 10 years?
Great question. Everywhere. Um, we are a young venture capital firm. We are now investing out of our second fund, hopefully starting raising our third fund soon in the next few months. Um, we do have a parallel fund that is currently in fundraising for pediatrics exclusively. I think Ship2B would like to be more present, broader at a broader scale, with larger funds, with more selected impact areas, and why not with other asset classes? Because in the end, right now with a venture capital vehicle, it's the impact we can make is very, I don't want to say narrow, but it's very determined in a very specific type of company in a specific stage of development. While by adding new asset classes or even new types of impact, maybe we can go out there with funds that are not returning market rates, but maybe a little bit below, so we can target different projects. In the end, we might want to be a multi-asset vehicle in order to have a broader impact, not only geographically, but also in terms of the type of project that we can invest, so we can make our impact broader.
That's a solid vision. How much capital do you have under management currently?
Right now, 60 million under management.
660.
60. 60.
And you're about closing the third fund.
And we are about to start fundraising for the
Mhm.
third fund. Yes.
So you are about, or you started already?
No, we will start probably in the next few months. We haven't started. We're still investing. We are still very focused in deal flow and closing our final investments within this vehicle.
Okay, so, in the next 6 months, so it's early 2025 then.
Probably, yeah, late 2024, early 2025.
Yeah,
Yeah,
which is nothing in fundraising. I think. What
yeah.
what were the types of investors that you're looking for your fund?
So we are looking for regular investors. We are looking for investors that are looking for this asset class, that might be experienced with philanthropy or not, that certainly have a purpose and there's an emotional component of what we do. They have to feel engaged with our purpose, for sure. But in general, we are looking for institutional investors and family offices that are into venture capital, that want to explore more diversification in their portfolio, looking at market returns and gaining this diversification with a different angle, with a different
Mm.
lenses. Right, we can provide. I think the way we look at and the way we compose our portfolio, by looking at people rather than technologies, makes our portfolio pretty diversified in terms of type of projects and in terms of size of projects. So I think we are a cool option, both from a purpose and impact perspective, and also we are a nice alternative within a venture capital portfolio, because it's also a different setting within the portfolio.
Yeah, I like funds who that are frequently raising new funds. It's basically their purpose to raise one fund after the other and provide capital to entrepreneurs. What's your minimum ticket size that you're looking for? Did you
For as an
For your next fund. So when some institutional investors are listening, what's the minimum size that you
we
would
haven't
be
defined this,
happy
but
with?
it will probably be around 200 or so.
Mm. And your investment focus with your next fund will be Spain, Europe, the
It's
world, Mars?
same theory of change, European focus.
Mhm.
We have now approximately 30% of our investments abroad. We might want to extend this percentage a little bit more. So we will continue expanding within Europe so far because we are European based and we want to contribute within Europe.
With Europe, you include also Switzerland, the United Kingdom, not only the European Union, but also countries that are in Europe outside the European Union.
Yes, exactly.
That's good to know. That's good to know.
Uh, yeah, yes, hopefully yes, it would be very nice to have at least one investment in most of the countries. That would be really great. Also I wanted to mention that the way we invest is we think we like to call ourselves as systemic investors, so meaning that most, not all, but most of our portfolio companies could have synergies among them. There could potential. We don't force them. We don't invest with pre-agreements or something. But they are all within the same ecosystem, and they could all potentially collaborate. Of course, some of them end up collaborating. We have some very interesting partnerships among them, but some that we might think that they could collaborate, they just don't. But we do like to think that we contribute as a system towards helping towards our theory of change, because otherwise it would be very difficult for us to really go towards the change that we want with very let's say singular investments here and there. So we try to have a systemic portfolio with actually the two funds that we have right now, and with the third one it will be exactly the same. So we will want to find synergies among all of our portfolio companies.
I couldn't agree more. I love this aspect. I totally agree that investors must be interested in building an ecosystem and connect companies and not just look at the investment as a single asset where they throw money and if it doesn't work. I think building ecosystems is a huge part of the success overall.
Exactly. Yeah.
I think Andreessen Horowitz, for example, I think they have built a tremendous ecosystem, connected their founders, and this drives then the huge gains further down the road.
Exactly. So that's the thinking behind it. Yeah.
That's great. Jordi, at the end of our conversation, before I ask my final question, is there anything open that you would like to address?
No, actually, it has been a great conversation, a very compelling conversation. We've talked about many things, and I think it's the interview in which I've been more open and I've had the chance to talk about more things. So no, I just wanted to thank you for this opportunity because it's been really a great time. I've had a lot of fun.
Thank you for coming on the podcast. I enjoyed the conversation as well and learned a lot of new things. But before we close, let me ask you the final question. There are many young funds currently starting out, young teams. They have great ideas. You have a little bit more experience now. Your team is about closing the third, or going fundraising for the third fund, and the next thing is then the closing, of course. Uh, what advice would you give aspiring healthcare investors that want to start their first fund?
Think bold. Um, Make sure, okay, so make sure that you have a differentiating proposal. Make sure to mm, pull out your proposition in terms of what's your unique deal flow, and what's your purpose for being out there as a fund. So what niche or what overlooked opportunity or uncovered market are you going to be tackling? Because this will be differentiating, and this will be what will drive investors to invest in you. So building your portfolio and building your uniqueness as a fund.
So it's basically a little bit of a USP, unique selling proposition, and defining their contrarian approach, why they make a difference, and what's not covered in the market. Is this?
Exactly. You say it much better than I do. So yeah.
No, 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 no. I just repeated your
But
words.
yes, yes, it's finding the contrarian approach. Yeah, I like this.
And I had the advantage of Luis Pereiras was on my fund. We talked a lot about contrarian approaches with his book. It was a fund in Barcelona. So
Yeah.
there's a lot going on in Spain.
There's a lot going on in Spain, as I said at the beginning. It's and in Barcelona in particular, it's a great ecosystem with many stakeholders, from pharma companies to CROs to investors to great universities. A lot going on. Luis Paleras, he's a great. I mean, we know each other well. He's a great fund manager. He's doing outstandingly well. And yeah, I also encourage people to come to Barcelona, to Spain, and people interested in the ecosystem, because there's a lot going on and many opportunities here as well.
Yeah, totally, totally. Jordi, thank you very much for this great conversation. I enjoyed every single minute of it. Let's catch up when you start fundraising or when you close your next fund, and let's see how healthcare developed and climate change developed in this 1 or 2 years.
Deal. Let's do this. Let's speak again once we have our new fund, and let's see how things have changed.
Super,
Awesome.
let's do so.
Okay, best of luck. Take care.
You
Bye-bye.
too. Take care. Bye.